In this video, we're going to discuss resources like mantherapy.org that need to be considered before treating depression, anxiety, and PTSD at home. This series highlights evidence-based, clinically tested, and scientifically proven resources. They have collectively helped hundreds of thousands of people treat depression, anxiety, and PTSD at home without the expense of a therapist. This video will explain how to get started. It will show you a self-evaluation from mantherapy.org and talk about some hotlines. Mantherapy.org is the home of the 18-point head inspection. You can fill it out in just a few minutes and it will give you an automated response. Nobody's going to contact you. It's completely confidential. Some people who are struggling with depression or PTSD also have anxiety that they don't really realize they have. This evaluation will help you determine what all is going on with you so you know exactly what resources to apply. Mantherapy.org also has a ton of other mental health resources for men, so check them out when you get a chance. You can also take more in-depth mental health screenings on the Mental Health America website. They too give an automated response. These screenings are at mhanational.org. There's a link in the description. If treatment becomes overwhelming and you need to talk to someone, we have some resources for that. Warmlines are phone, chat, or text lines that provide empathetic listening and peer support to individuals in distress but not currently suicidal. It is also a place to explore treatment options. Warmline.org will show you a list of all the local and national warm lines in the United States. If at any time during treatment you are suicidal or in crisis, call 988 Crisis Hotline or dial 911 for immediate help if it's an emergency. If you are active military or a veteran, press 988 and then 1 and you will be redirected to the Veterans Crisis Line, which is for vets and their loved ones. You can also text 838-255 or chat online on their website, which is veteranscrisisline.net. These hotlines are also a great way to help suicidal friends or family members if you don't know what you're doing. The people you call on those lines, they do this for a living. They will know exactly how to handle that situation. If it's an emergency, of course, call 911. The resources we highlight in this series are the absolute best ones for treating depression, anxiety, and PTSD at home. If one doesn't work, move on to the next one until you've tried all the ones that apply to you. And if that doesn't work, seek treatment outside of the home. The biggest mistake people make is giving up after the first thing they try doesn't work. There isn't one magic treatment that helps everybody. You have to keep working at it till you find something that works for you. Also consider laying off the alcohol until you get better. Alcohol is a huge contributing factor in suicide. Sleep deprivation is also a significant factor in suicide and mental health issues, so practice good sleep hygiene. Regular exercise can also help improve mood. These are all things you can start today to improve your mood and lower your suicide risk. Cognitive behavioral therapy is the original behavioral therapy and is still the go-to solution for treating depression and anxiety. It can also be used to help treat PTSD. Click the link here to learn about the absolute best CBT resources for at-home use. Help us prevent suicide by sharing these videos. Also, like, subscribe, and comment to help that algorithm show this video to someone who needs it.